This is a short presentation as part of accepting the Schrier Award that was presented to us by ISN in the year 2020.
My name is Dr. Kajiru Kilonzo. I am a nephrologist here, physician at the Kilimanjaro Christian Medical Centre.
Okay, my name is Huda Akrabi. I'm a physician at KCMC and working in the dialysis unit at KCMC.
I'm Karen Yeates. I'm a professor of medicine at Queen's University in Canada, and I work as a nephrologist.
KCMC is located in the northern part of Tanzania, in the slopes of Mount Kilimanjaro, the highest mountain in Africa. 9 years, many events were notable. From 2012, where we started annual screening and public education campaigns and starting a nephrology clinic after having the first trained nephrologist in KCMC, to the level B, where we have our hemodialysis unit launched, and also we hosted a national nephrology conference at KCMC. Finally, to a level A, where we started supporting the other centers in northern Tanzania with CME to educate dialysis nurses and doctors. So the impact of the Sister Renal Center program, the impact on services, we had an acute PD program for adults and children, which are still ongoing. Also, we launched a hemodialysis program and a nephrology clinic. So with regards to training, we had a trainees supported by ISN. We had Dr. Kajiru Kilonzo, who did his fellowship in Cape Town in 2014, and Dr. Sudakshina Ghosh, who completed her ISN fellowship in India in 2015. With regard to research, we have a published work in press and some ongoing researches. So to mention some, for the published work, we had an outcome of acute PD in northern Tanzania. Ongoing researches, we have a CKDU in northern Tanzania, Kilimanjaro acute kidney injury study. We have a lot of success with the program, but to mention a few, KCMC had successfully moved from not being able to provide services to manage acute and chronic kidney disease to being able to provide and comprehensive. When we talk about acute kidney injury, all AKI patients at KCMC have access. Also, pediatric AKI, we're providing PD fluid locally, largely at the bedside as an option for pediatric patients. Challenges. We have several challenges, but to mention a few, human resource is our greatest challenge towards developing a more comprehensive nephrology care. Also developing more capacity for renal biopsies through strengthening pathology infrastructure and renal pathology expertise locally. Providing access to all patients who require renal replacement therapy is a challenge, as national health insurance helps greatly in covering dialysis costs for their members, but affordability of uninsured patients is still a big challenge. Accessibility of nephrology services in the northern zone of Tanzania. We have very few centers, almost 4 centers in the whole northern zone of Tanzania. Maintaining a supply of commercially made PD fluid has been an ongoing challenge. So the way forward. The Emerging Center, the Emerging Center is planning to form a trial and is exploring opportunities to support a new emerging centers within the northern zone of Tanzania. And the Sister Renal Center relationship will be sustained through regular mentoring visits by the supporting center to the new emerging center in the trial. The supporting center will provide ongoing support to the emerging centers to develop further diagnostic capabilities, as well as treatment programs for patients with acute and chronic kidney disease. Training of new local nephrologists through the ISN fellowship program, and build up a multidisciplinary team to tackle all aspects for a comprehensive renal care.
Sure. I've had a wonderful experience working with Dr. Kilonzo and Dr. Akrabi. It's been one of the most inspirational and motivating times of my career as a nephrologist. And I had a quote here, which I think says it all. The partnership has been deeply rewarding and impactful due to the continuous commitment and tireless efforts of Dr. Kilonzo and his team of trainees, colleagues, and nurses who made the Sister Center partnership the success that it is today. The the initial ability of Kajiru and his colleagues to be able to provide acute peritoneal dialysis, which then ultimately became a hemodialysis unit as well. So being able to provide dialysis services to save people's lives was, for me, one of the most rewarding things. The second most rewarding memory for me, or aspect of the program, was when Kajiru finished his ISN fellowship in Cape Town and returned to KCMC to carry the weight of the kidney world in northern Tanzania on his shoulders. Rapidly promoted to head of the Department of Medicine and head of the Department of Nephrology, and trying to get a hemodialysis unit open. It definitely was great having the support of the ISN, and I think it's the Sister Center program is a wonderful program. And you can see now they're supporting an emerging center, which is terrific. And thinking about training and fellowships and transplant is wonderful.
From our collaboration, my most proud moment was going to a real rural Africa. If you think Moshi is rural, you haven't seen anything yet. I went to Mtwara, and this is just like in the really interior of Africa, where access to a lot of things is just not present. And to be able to train a group of doctors, these are just medical doctors who have finished internship and are working there, to train them to insert a peritoneal dialysis catheter, and to train the nurses to successfully move somebody from uremia, and eventually I can say that person, I can remember the person was lying on the floor, full uremic, and I just got a picture the other month. He is sewing clothes after getting a renal transplant from Tanzania, from Muhimbili. So that I would say is my most proud moment, and I can really thank Karen and ISN for that.
So my pleasant memory is when Dr. Kajiru was away for training, and I was working as a physician by then, but there was no dialysis service when Kajiru left. And once I was treating a patient, and he told me, "I know you will save me." And by then I did not have any idea about dialysis. Like, I know what is dialysis, but we did not have the means to dialyze the patient. But when he told me, "I know you will save me," I had to take an extra mile and call Kajiru, "What should I do? I want to dialyze this patient." And he started instructing me from zero. Like, you have to put a catheter, and you have to do and this. And then we inserted a tank of catheter by help of the surgeons, and we did a locally made fluid, and then finally we got a commercial after a few days, and the patient survived for 2 years or more. So that was a very proud moment, and since then I became inspired and like nephrology.
So we'd like to acknowledge the International Society of Nephrology and Professor Karen Yeates. Nothing would have happened without her. And the Nephrology Society of Tanzania-Canada, that has also been very supportive of the Northern Zone and KCMC in general, and the government of Tanzania through its Ministry of Health, Community Development, Gender, Elderly and Children.